Everybody, Daniel here. Today I want to talk to you about pain. Okay, most people who come to seek any type of medical help do it because something hurts. They have pain. Yet, most clinicians don't understand much about pain, which is a contradiction because pain is the number one reason why people see therapists. So, what is pain? How would you define pain? How do you manage your pain? I'm going to try to answer a few of these questions today. Definition of pain is an unpleasant sensory or emotional sensation caused by real or perceived damage. When we talk about pain, people tell me, oh, it's just irritating, it's not painful. For me as a clinician, pain is the whole range from just a little bit of irritation, discomfort, to agonizing, the most pain you experienced ever. This all comes under one umbrella, pain. Generally speaking, it is quite true to say that if you fall down or you have a traumatic event, you got cut, you fell, you had a car accident, something happened with trauma, in these instances, there is better correlation between how much pain you have and how much tissue damage you have. However, if you're experiencing pain for a long time, usually more than 3 months, that correlation between how much pain you have and how much tissue damage you have just is not there anymore. And that's when things get more and more complex. Because of that reason, therapists always recommend to clients, don't wait too long with your pain. If you have or you're experiencing pain for more than 2 or 3 weeks, seek help, because at the beginning, there's a better correlation between how much tissue damage you have and how much pain you have. And the more you stretch things out, the less correlation between pain and tissue damage, and your brain becomes more and more comfortable producing that pain, which ends up with you having pain regardless of anything wrong with you. That's what we call chronic pain. Finally, I want you guys to understand, pain is not your enemy. Pain is an alarm system. Pain lets you know if something is wrong or might be getting or might be wrong in the future, and you need to respond to it. Which brings me to how to manage your pain. If pain is an alarm system and the alarm system is turned on to tell you something's wrong with you, and your response to this alarm is to turn it off, do you think that's going to help your body? I can tell you it won't. So this practice of taking pain medication so you don't need to deal with your pain is not a wise strategy. There are times where your pain is so severe and you cannot just focus on daily activities. You can't do anything because you're in so much pain. You can't cook, you can't take care of yourself, you can't go to work. In those instances, when your pain is so severe, please take some pain medication. That's why we created it. However, if your body is telling you that your shoulder or your knee is hurting, but you planned that day to go for a run, turning off that alarm system so you can do what you wanted to do without responding to what your body is telling you will lead you into trouble. I can tell you from my experience working in the Mayfair that there are a lot of people who go play tennis and it's their routine to take an Advil or two before they get on the court so they don't feel any pain. These people will probably play that game that they intended to or participate in that clinic that they wish to participate in, but in the long run, they will not have longevity, because if you're turning on the alarm system that's telling you that you're irritating something in your body, and you are irritating it again and again and again without knowing that you're irritating it, the price that you will pay when finally your shoulder or your knee or whatever you're trying to medicate is going to be painful. That injury is going to be a lot worse than dealing with it at the beginning when it was just a low-grade pain and you should have dealt with it. For those of you who train in gyms or doing your routines and you're not quite sure of how to differentiate different types of pain, there's some rules of thumbs that I share with my clients. So if you're not medicated, because I do not ever advise people to take a painkiller and come exercise or play tennis or do whatever, we just discussed that and the reasons why. But if you come to the gym and you're experiencing some pain, these are the rules of thumb. If you have a sharp pain, meaning you did a movement, you press and you have a ouch, please stop what you're doing and don't do that exercise again. If you're doing a press, a routine, and you're going back and forth and you're feeling that your shoulder has some soreness in it, try to decrease the weight a little bit. Try to make the exercise a bit easier. Keep on doing it. You don't need to immediately stop and not do that exercise again. You can try to lower the intensity of that exercise. That's number one. Number two, if you keep on going and this low-grade soreness is gradually increasing, there will be a price to pay for this achiness later, maybe after the workout or the next day. So it would be advised to stop. If you're doing this and you're in the middle of a competition, and this competition is important, no worries about pain. Park the pain in the recesses of your brain and finish your competition. However, most people are not really competing. They're just coming for a workout, and there's no need to have a month of shoulder pain to complete one exercise in the gym. So if your achiness is gradually increasing, even though you try to modify the exercise, please stop. If your achiness is gradually decreasing, as you do more repetitions or more sets, your pain is gradually going down. You're borderline, but you're okay. There might not be a price to pay. Still, if it's ongoing on a regular basis, you will be wise to check, why is this sore? Generally, when you're exercising, nothing should be sore. When you finish a workout, you can have what we call delayed onset muscle soreness. That's the normal muscle soreness. If you did a good hard workout, your muscles hurt the next day, sometimes for a few days, sometimes just for one day. But if your back hurts, if your neck hurts, if your shoulder hurts, if your hips hurt after a workout, something in your workout was not right. Please look into that. Many times your pain will be in one area, and what's wrong with you is going to be, or the reason why you have pain is going to be in a different area. Okay, so please let the therapist try to come up with a hypothesis on why you had this pain. This question is easy to answer if there's a story of trauma in the story, but if there's no trauma, it means that something that you did, whether a posture that you held or a movement that you repeated, or an activity that you do at home is causing you to develop an injury. If you will not get to that movement or posture or that activity that's causing you pain, really, you're never going to completely resolve your injury. So when you go to see somebody, it's not good enough just to name what's wrong with you. You need, by the end of the assessment, to have some kind of a hypothesis on what movement, posture, or activity you're doing to cause you that pain. Thank you very much for listening. Hope that this helped you getting a little bit, give you some more tools to manage your pain at home.